So can you inform me if PEMF therapy is helpful for fibromyalgia? And the answer is yes. We've talked about this on other Q&A webinars. And so I think I've dealt with that question pretty adequately. In my book, I also deal with the topic of fibromyalgia. Fibromyalgia is a chronic brain problem. It's more than that, clearly, but it's a chronic pain problem. It's a chronic pain-brain problem. What initiates it, it's very hard to know. We know that there's a lot of association with fibromyalgia with viruses and other toxic molecules that have gotten into the nervous system of the body. Genetics probably plays a big part in it. And then down the road, as the problem continues, again, you end up with the chronic pain-brain. One of the, I should mention, one of the discussions that we had in the summit was about something called the brain gauge. Dr. Mark Tarmerdal and I are going to be collaborating on using the brain gauge to help people with their chronic pain. So what you can do then is you'll be using the brain gauge, you'll be able to monitor the impact of the treatment that you have on your chronic pain and how it has affected your brain. You'll be able to see the amount of effect that you're having in your brain as a starting point, as a baseline, and then monitor the effectiveness over time. So on drpawluk.com, we don't have this yet, so don't write me yet. You'll have to keep an eye on our website. We'll be offering the brain gauge to people who are purchasing PEMF systems, some PEMF systems, for their chronic pain, to be able to have you monitor the effectiveness of your treatments to your brain. And certainly one of the recommendations that we'll be making is that you do treat your brain. So even though your pain is in your elbow or your shoulder, but it's been there for a long time, it's affecting your brain. So we want to be able to quiet the brain down so the signals from your shoulder, for example, going to your brain will be lessened in terms of the way the brain perceives it. So the brain gauge, and there's a website, if you do a search on brain gauge, or again, if you listen to the webinar on the brain gauge with Dr. Mark Tarmerdal, or the summit rather, with Dr. Mark Tarmerdal, you'll be able to get more information about the brain gauge. So we'll be doing this probably in the next 2 to 3 months, getting that program going for you. So fibromyalgia is one of those conditions that the brain gauge would be very, very useful for. You can purchase it or you can rent it. You could even do it today. You don't even need to wait till we have our own program. It's up to you. So fibromyalgia, again, I would treat it in the brain. I treat it in the upper body. Fibromyalgia is also a condition that you probably need to have a stronger PEMF system. I mentioned before that you have basically superficial systems. And I'm going to name several of them right now. The QRS, the IMRS, the Medithera, the BioBalance, and there are others, the OMI, etc. All of these systems that are Gauss or less, or even under 5 Gauss, are probably not strong enough. They can fool your brain. But I'm not, it's important to fool your brain. It's important to lessen the pain, no doubt about it. But you don't get a long-term benefit from doing that. Just like you don't get a long-term benefit from using painkillers. Painkillers are good in the short term, but not in the long term. And we know about the opioid crisis, where you become dependent on them, and then we try to withdraw from it. It makes everything worse, including the pain that you had before. So what our goal is to try to heal the body, to heal the part of the body that's causing the problem, and to heal the brain, the inflammatory components that are making the physical changes in the brain over time. So we want to be able to deal with all of that. So we want to treat the shoulder to get rid of the original source of the problem. And we also want to be able to treat the brain to decrease inflammation in the brain and quiet the brain down. So combining the treatments becomes important, and having the right intensity of the magnetic field becomes important. So you really can't go cheap on this. You really have to think of this as an investment that you're going to be able to use for a long time. Going to somebody for treatment is going to give you benefits like that. How long does it last? Rarely does it last more than a few hours. Maybe if it does, maybe it might last for a day or two, but then it's going to be back. So how much money do you want to keep pouring down that funnel to keep going to somebody to get treatment when you really need to be owning your own system. Now, I think getting treatment with doctors or chiropractors or other people who own PEMF systems is important. I have a lot of people coming to me who have realized they get benefit from these systems. But they say, well, you know, I know I'm going to have to lay out $70, $100, $150 every time I have a treatment session. Well, eventually it's going to add up, right? And you made an investment in those treatments, but you have nothing to show for, and the problem's still there. So basically what I'm exhorting you to do is to think about getting your own system. Okay, as a family physician, I always wanted people, as a holistic physician, I've always wanted people to take care of themselves. I tell my patients routinely, I'm not your doctor. You're your doctor. I'm your consultant. You have to take care of yourself, and you have to make wise decisions about your own health, right? You can't rely on somebody else to fix you. And I'm sure because you're listening to this webinar, you're not one of those people who's relying on somebody to fix them. It'd be nice if you could, right? If you have a needle in your hand or a nail in your hand, obviously you fix yourself, you remove it. But not all chronic pain problems are that easy to fix. So again, take care of yourself. Be your own best doctor, and consider getting yourself your own system and investing in the Summit VIP series. Okay, so fibromyalgia, and it's long-term. You have to think of this as a long-term process. I wish I could say that you can get a benefit like that overnight, but rarely, because you have to heal the tissues. So healing takes time. If you break a bone, it takes time to heal that bone, to make a new bone, to repair the bone completely. You can use it fairly quickly, but it takes a long time to repair it completely. And the same thing applies to the brain and fibromyalgia.